Today we will be discussing life as a Parkinson's disease patient and clinical reasoning behind the interventions.
Parkinson's disease is a nervous system disorder that is caused by a gradual breakdown of nerve cells called neurons in the brain. Neurons are cells in the brain that produce dopamine. A decrease in dopamine production leads to atypical brain activity and impaired movements. Official causes of the disease are unknown, but potential causes include genetic factors, environmental triggers, and presence of a protein called alpha-synuclein. Risk factors for Parkinson's include age, heredity, being a male, and exposure to toxins. There are several common physical manifestations to Parkinson's disease. These include tremors, which are involuntary rhythmic contractions that lead to shaking movements in one or more parts of the body, bradykinesia, meaning slower movements, rigid or tense muscles, noticeable changes in handwriting that often lead to micrographia or small handwriting, a reduced speaking volume, impaired posture and balance, such as a hunched over or stooped posture, a difficulty performing automatic movements, including blinking, smiling, or swinging arms when walking, and finally, a difficulty with fine motor skills, which involve movements that coordinate the small muscles of the body with the eyes, hands, and fingers. Parkinson's disease also comes with several key psychological manifestations. Common manifestations are difficulty sleeping, depression, and anxiety. 20 to 40% of people with Parkinson's also report psychosis symptoms, such as hallucinations or delusions. It is also common to develop dementia in the late stages of the disease.
Parkinson's patients may lose some ability to perform their daily activities, and occupational therapy can help with those activities. Some therapeutic considerations specific to OT include a modified approach to change their environment or tasks to better fit their abilities, a compensatory approach to daily activities such as eating and drinking, bathing, toileting, dressing, household duties, meal prepping, and more. An example of this would be using a spoon with a bigger grip or a longer spoon. Orthotics such as a cane or walker for mobility, establishing a routine for better medication management and educating patients on the importance of following the routine, and group interventions to promote social interaction and recreational activities, as well as other assistive devices to help with riding or driving. Since Parkinson's disease is a progressive disease, it cannot be cured. However, the symptoms can be managed and the progression can be slowed. There are medications to help increase dopamine levels, prevent hallucinations that sometimes occur with the disease, and medications that help with tremors. Surgical interventions include deep brain stimulation to help with tremors and slowness, as well as MRI-focused ultrasounds to help with tremors. Lifestyle considerations include diet, exercise, physical therapy, occupational therapy, speech therapy, and massage therapy.
The client we interviewed is an 89-year-old female diagnosed with Parkinson's disease in 2020. Some of the symptoms she's experiencing is difficulty walking and using the upper extremities, specifically her right arm, leading her to have to use her left arm during functional tasks. She has slow speech, a negative self-view, irritability, difficulty eating due to decreased coordination in her upper extremities, and slow movements. Some of her interests include gardening, baking, and cooking, reading, and making puzzles, which have all been affected by her symptoms of Parkinson's disease. The influence that Parkinson's disease has had on the client has been from decreased coordination and motor functioning, making it difficult for her to complete certain occupations. One of those occupations includes getting dressed, so it's difficult for the client to flex and abduct her shoulder, so putting on a t-shirt may be difficult for her to coordinate and do by herself. She has very staggered and shuffling movements when she walks, so the use of a wheelchair is necessary, and the client is really unable to ambulate by herself, so she utilizes a wheelchair for that task. Brushing her teeth is difficult because she is unable to really coordinate the movement of bringing a toothbrush from the table or the counter up to her face and flex at her elbow and her arm, as well as maintaining that motion and holding endurance throughout the task. Showering is also difficult due to this decreased shoulder motion. Gardening is difficult because she has decreased balance, slow movements with her arms and her legs, and the client is also unable to drive and participate in that movement due to slow reaction times and again that difficulty with endurance and holding body parts in certain positions. Parkinson's disease, the client has had to make some home modifications, which include adding a shower chair and a removable hose in the shower to make the task easier for the client and able to be more independently completed. She uses a wheelchair, rugs have been removed in the house to avoid falls, a ramp has been placed from the driveway to the front door to make it easier for the client to move in and out of the home. Grab bars were placed by the toilet, and a rush pop socket was placed on the phone for better grip when communicating with family and friends. Personal relationships have been kind of strained with her family and with her friends due to kind of her irritable attitude, and this has disturbed her roles as a mother, a grandmother, and wife. And she's also had a decreased desire to go out and see friends because she doesn't really like having the assistance to get around and wishes she could drive and ambulate by herself. Although she has a strain on her family and friends' relationships, she has a very good support system with her caregiver who comes over every day. Her family and friends are still supportive, her social worker, and her PT and OT. The client participates in occupational therapy services. She finds it difficult to notice any progression and benefits due to the disease being progressive, so she feels like she's constantly getting worse every day, and that OT doesn't really help, but it's really just there to help her maintain function and complete tasks independently with the condition that she's at currently. OT interventions include the 9-hole peg test, stretching to maintain range of motion, fine motor skills. She uses pulleys for her shoulders. She picks up clothespins and places them on a ruler, again practicing those fine motor skills. She also does strengthening, and this palliative care has been suggested to manage mental, physical, and behavioral through an interdisciplinary care team.
We interviewed Dr. Bridget Hahn, a faculty member of our OT department here at Rush University. As a practicing occupational therapist, Dr. Hahn has worked with many patients diagnosed with Parkinson's disease. Dr. Hahn discussed with us various therapeutic mechanisms used interchangeably with Parkinson's patients. Oftentimes, those with Parkinson's experience on and off times, where symptoms are more or less severe depending on medication management or symptom flare-ups. During those times, some therapeutic mechanisms will be focused on more than others, such as finding appropriate medication dosages and focusing on patient safety. Some of the major therapeutic mechanisms used with Parkinson's patients include LSVT training, retraining movement patterns and increasing coordination, energy conservation, fall prevention, and medication management. LSVT BIG training is a certification therapists can receive to aid Parkinson's patients during treatment. This form of rehabilitation includes patients recreating big, exaggerated movements to help increase body movements, coordination, and verbal awareness. When working with Parkinson's patients, it's important to include high repetitions in any activity to encourage the retraining of movement patterns and strength. Energy conservation is a priority as Parkinson's patients fatigue very quickly with walking and other activities. Energy conservation allows patients to participate in activities they enjoy. Alongside energy conservation, Parkinson's patients oftentimes have a tremor, which can cause imbalance and shuffling of feet during ambulation. Working alongside the occupational therapist to learn functional safety during ambulation and ADLs is necessary to avoid any injury. Patients with Parkinson's oftentimes have multiple medications to take throughout the day. Medication management is important in keeping symptoms managed in order to safely participate in daily living. Dr. Hahn mentioned numerous factors that influence the plan of care for her patients. Age is a significant personal factor. Since Parkinson's is a progressive disease, as the patients age, they will have more difficulty completing their ADLs. The patient's goals will be considered based on the age of onset and the progression of the disease. An additional personal factor is their habits or past and current behavioral patterns. Learning from a patient what their past routines look like will help to shape goals and outcomes for the plan of care. Some environmental factors to consider are their physical environment and assistive technology.
Knowing the patient's home environment and if they have access to assistive devices or medical equipment in their home will impact the plan of care and the safety considerations we have as occupational therapists. It is also beneficial to know the patient's support systems from their family and friends, as it is an important aspect of care for the patient and the resources available to them.
Dr. Hahn mentions numerous precautions that should be noted when working with individuals with Parkinson's disease. Some of these precautions include bladder and bowel dysfunction and fall risk. Dr. Hahn states that individuals with Parkinson's disease will likely have fall precautions due to postural instability, decreased trunk mobility, and will appear very rigid when walking. Another precaution includes medication. As medications wear off, the patient may become impulsive due to altered dopamine levels. Patients will also have an on time that is optimal for therapy sessions where movement comes easier. They can also have off sessions where movements are more difficult. Dr. Hahn would use narrative reasoning to get a better understanding of the client and how Parkinson's disease has influenced all aspects of their life. This form of reasoning allows therapists to determine patient goals and values, applying those to the interventions they use to treat Parkinson's disease. It also allows for therapists to create a relationship with the client, showing that they are there to help them accomplish things that are important to them. Dr. Hahn described that we meet the patient where they're at, taking into account their current state of functioning and listening to the patient to understand how their level of functioning influences their daily activities.
Procedural reasoning is when therapists consider and use interventions and routines for identified conditions. They may be science-based or may reflect the habits and cultures of the intervention setting. Dr. Hahn used her procedural reasoning to find specific interventions for individuals with Parkinson's disease. Usually, Parkinson's disease patients have decreased range of motion and inability to create big enough movements to perform daily activities. LSVT BIG training is an evidence-based intervention for individuals with Parkinson's disease. This training has patients practice sitting big and tall, exaggerating all of their movements. This type of therapy is used to retrain the brain to produce those bigger, fuller movements to support their daily functioning. It is also proven to improve balance, gait, functional reach, and bed mobility. Dr. Hahn used her procedural reasoning to identify this science-based intervention as a way to treat her patients with Parkinson's disease.
Interactive reasoning is used in face-to-face interactions between the client and the therapist. It is a collaborative approach where the therapist listens to what the client values and how they feel about different interventions. This ensures for a collaboration with the treatment plan. Dr. Hahn incorporates interactive reasoning by trying to meet the client where they're at. Here, she can use interactive reasoning to find out what they value and what the activities they would like to work on. Specifically for someone with Parkinson's, Dr. Hahn will use empathetic listening to understand how the client feels and make changes based on what the client says. Together, they can identify any potential deficits and establish a plan. This can establish a positive interpersonal relationship with the client and increase motivation.